Yes, thank you so much, colleagues, and from every corner. And we are hoping others will join us along the way. That for that reason, we are going to continue. For today's session, we are going to be sharing mostly our experiences with the team, and we are going to have some good time looking at the concept. Yeah, so I hope those who will join us will find us on the way, and we are hoping everyone will be able to find us. What we might like to remind each and every one of us is that can we ensure that anytime maybe we are joining as a group, let's try to ensure that we are all in the group registered for those who are interested to be registered. Even if we will join together in one gadget, we can then register ourselves. Like when you are logging into the session, when you are joining the session, it will ask you, are you joining alone with others? Then if we are joining with people who are registered, then you are able to log in them there, selecting their names. It then helps when it comes to getting the participation certificate for those who may want to get it after they've finished their post-test. So we request that we do so. And also today we will be looking at family assessment and support during the different trajectories of the condition. So we'll be looking at discussing in details, maybe sharing also our understanding as a team on how best we can deal with the family as a client faced with this life-limiting and threatening condition per our WHO definition of palliative care. So yeah, so that's what I will say. So last week we were doing family meeting, and one of the critical things we came with from that presentation was that one of the things we need to be cautious of as a clinician is to involve the families as early as possible. And we get the opportunity to know that Manzini Hospital, they've even reached a point whereby they are now adjusting their plan of care in terms of dealing with these patients. So they are looking of ways to incorporate the families as early as possible. So we are hoping that maybe that strategy, I'm happy today also have Matsenjwa, whom we were looking for very much last week's session, but today he is here. Yeah, so we also have others from other departments. So we are hoping we will come up with the best information and share the best practices, but the core issue or the core gist of our discussion today, it's around the family support and then how best we can support the family. So I'm happy if we have people from the hospital-based setting, like we have Matsenjwa here, and I'm happy others maybe will join from the other setting because now the hospice team, it's in the community setting. But we will be sharing the ideas on how best we think we can do in our different spaces, and then looking how best we can support them across the disease trajectory or their journey to the end. So that's the reason we will have only the didactic presentation today, presented by Tebandla Mavuso, social work from UNISWA. This is just a presentation to give us an idea of what the family is and understand how it might be working. I know some of us are clinicians and we know what a family is and we understand. This is just a reminder to us. So, but then after it, we will be also discussing based on the information that is presented and on the context of what is happening in our place. Let me also emphasize that should it happen that you want to reference to a client that is under your care, please ensure you keep the actual location, and you also protect the patient's identity. So it means the name and related names. Just mention the client, maybe the condition, the region is fine. But whenever you make an example, I'm making this so that we remember when we are discussing. Yeah, for that reason, may I give Gebandla this opportunity to present the presentation, then we will continue with the discussion thereafter. Sure. So that's the presentation. Put the presentation.
Good day to, as Mr. Matlamu has mentioned. My name is Stebangama Vuso, and I'm a social work student at UNESCO. I'll be taking you through today's session as we discuss family needs assessment and support in palliative care, which is a topic that is very crucial as it helps us understand the unique needs of families and how we can better support them through their journey. So, this is the overview and some of the things that we'll discuss in this presentation. And I would want to dwell that much on it, so we'll move on to the introduction.
I don't know if we can all see the presentation that side. Today the network is not friendly with us, so I don't know if we can all see the presentation. I hope now you can see it.
I know that in the past sessions that we've had, we've discussed our palliative care in depth, but then I will just give more of a summary of palliative care so that you can better understand the topic that we'll be discussing today. Palliative care is a crucial aspect of health care that focuses on providing relief from the symptoms, pain, and stress of serious illnesses. It encompasses a holistic approach to care, addressing the physical symptoms, emotional well-being, and social support and spiritual needs. This therefore means that it is designed to improve the quality of life for both the patients and their families. And as we encompass a holistic approach, that means that we address the physical aspects of care, the emotional part, and then the social as well as the spiritual part of care. It is appropriate at any stage of illness and can be provided alongside curative treatment, which clearly means that there's no specific time or period where we can provide palliative care. It can start on the onset of diagnosis or even in throughout the stages of the illness. There's no specific time where we can say maybe it's for end of life or whatsoever. It is appropriate at any stage of illness. Palliative care is patient and family centered. That means that it does not only focus on the patient, but also the family involved. And as the primary goal is to improve the quality of life. So we ensure the comfort, dignity, and support throughout the course of illness for both the patient and also the family. By conducting a family needs assessment, healthcare providers can gain insights into the specific challenges and concerns that are faced by those families. And therefore, it can be used to tailor support services as well as intervention to meet the unique needs of families. So it is very much important that we recognize the diverse family structures that are there, as we know that family is the cornerstone of society, providing love, care, support, as well as stability for family members. Our family forms an integral part of our life. Despite hectic lifestyles, the family continues to be the soul of any individual. And I am sure that we are all aware of the types of families, but we have the nuclear family that consists of 2 parents and children. We have the extended family that comprises of grandparents, uncles, aunts, and so on. We have grandparent family, which are sometimes grave situation first, which comprises of grandparents being the primary caregivers due to so many situations that they find themselves taking care of their grandchildren. We have single parents whereby there's a mother or a father alone raising the children. We have childless family, the ones that choose not to have children or it is by circumstance or whatsoever. We also have step family that consist of we also have step family that consist of blended families, whereby we find that people have been divorced or are separated and then decide to come together and form a family of their own. We also have chosen families which comprises of friends and significant others who are not related by blood or marriage but have strong emotional bonds. And also LGBTQ+, which include same-sex couples with or without children. We also look at why do we need to recognize family dynamics using the family systems theory. This theory views the family as an interconnected emotional unit, and according to this theory, family functions as a system where each member's behavior affects and is affected by other members. So this theory means that the family is seen as a complex whole with individual parts or members that are in continuous interaction. As we can see the diagram there, we can see that the individuals in the middle, but then it's interconnected to the nuclear family as well as the extended family and also the social level. So it is very much important to understand that an individual or a patient cannot be understood in isolation from one another, but rather as a part of their family. We can see their interactions and then identify areas of conflict. As family systems theory is usually compared to the human body, whereby we know that we have different organs or parts of the body that all work together to create stability, to create function for the entire body. We have eyes that have their different responsibility, that have their different role that they need to play for the body to function well. So family systems theory help us understand that a family, every member of the family is important and also crucial for the functioning of the family and also creating homeostasis as well as stability in the family. And we also look what is family needs assessment. Family needs assessment is a systematic and transparent process that provides information about social needs or issues in a family and determines which issues should be prioritized first for action, which means that even if we discover that there are certain issues, we should try to prioritize them. We should find ways to know which ones should come first in our interventions. Determining needs is a subjective process, as different people are likely to have different views on what is required for the family's well-being. As we all know that as people, we may have different views, we may have different perceptions of certain issues or certain challenges that we face, and what I see as a problem for someone else may see as something that is just normal. So it is important that we focus more on the views of people and try to figure out what is right and what should be prioritized for action. A key distinguishing factor of family assessments is that it looks at the interrelationships between family members and how these relationships impact an individual within the family. It is also important to conduct a needs assessment at the onset so that interventions are appropriately tailored to the individual and the families you serve. The assessment should identify the strengths, the vulnerabilities, fears, and the perceptions about their situation, prior effort to achieve their needs. If there were things that they have done before to try to help themselves, or if their assessments, if there are prior efforts that they practice to help themselves, if they worked or if they did not work, it is important to figure that one out in family needs assessments. We'll also look at the components of family needs assessments. A comprehensive family needs assessment should include a range of components such as emotional needs, whereby we look at the emotional well-being of the family as well as the patient and provide the necessary counseling or therapy they need if that is the case. We also look at informational needs, which includes providing appropriate and information related to the patient's illness or treatments or things that they need to practice in order to safely guard the patient or the journey of the patient in the journey of the patient in the journey of the patient in his or her illness. We can also look at practical needs, whereby we try to provide practical assistance to the clients as well as the family, which may include caregiving responsibilities as well as financial help if need be. We also have financial needs that includes having a stable income, managing expenses and planning for the future. Conducting a financial needs assessment can help identify any financial stresses or challenges impacting the family and develop strategies to improve stability. We also have social needs that includes maintaining social connections or relationships and addressing social isolation if the client is facing any of those. And we also have spiritual and cultural needs that talks to recognizing the importance of spiritual and cultural beliefs that the family or the client may have in coping with illnesses and providing appropriate support and resources. We also have bereavement needs that looks at anticipating the needs of families following the death of a loved one and offering bereavement support services to the family. We also have models and theories that one can utilize in family needs assessments. I know in the past sessions we've looked at biopsychosocial, socio-spiritual model that tries to look at a person or a family holistically and recognizes that human beings are complex entities that are shaped by the biological aspect, the psychological aspects, the spiritual aspect, as well as the social aspects of life. So it is important in needs assessment that you try to figure out all these aspects and how they can affect one's family. We also have Maslow's hierarchy of needs that can be utilized to provide a comprehensive approach for the assessment of family needs, starting with the basics, which includes the physiological needs. As Maslow's theory says that for one person to move up the hierarchy, it is important that their needs are met from the physiological up to the self-actualization stage. So it is very much important to know if the client or the family have their physiological needs met, if they have their safety needs met, because they cannot climb up the hierarchy if their needs are not met. So it is very much important for one to understand that and try by all means to make sure that the family has all their needs met. So we can use these models and theories to assess the needs of family. We also move on to methods of family needs assessment, like methods that we can use to find needs, family needs. We can have interviews and questionnaires whereby we have direct conversations with the family. They express themselves, they tell you what stresses them the most, they tell you what they need the most, and we can have standardized tools and surveys like questionnaires whereby you may have questions for them that they need to answer. So yeah, you may also observe the family and monitor their interactions, their dynamics, their communication patterns, their behaviors around each other, and you can get a lot from that. We can also have collaborative care meetings whereby we may invite a multidisciplinary team to discuss things that are related to the clients, to the illness and everything, and also include the family in those care meetings. We'll move on to the importance of family needs assessment. One of the things that are most important is that we get to have a comprehensive understanding of family needs. This is because when you talk to the family, when you hold those meetings, you're able to understand their needs better, as they are the ones who are in need, they are the ones who need the help. So there's no one better than themselves to share those needs with you, and then you get to understand them, and holistically, as you can be able to find all the aspects, the biological, the psychological, the social aspects, and the spiritual aspects. It is also helpful in providing personalized support plans that address the unique needs of the family. It also improves communication and family involvement, as everyone can be given the chance to voice out their views and their input in the care and the stability of the family. It also helps in family empowerment to take active role in planning and decision making. As you all know, that you don't make decisions for the family, but then you help them to make the decision by providing them with the necessary information and also services that they need. We also the last point in importance of family needs assessment is that it ensures continuity of care by identifying ongoing needs and anticipating future needs that the family may have or the clients may have. We also look at the challenges in family needs assessment. This include the diverse family dynamics that may result in conflicts, as people may have different opinions, people may have different views on how things are supposed to be done or how they are expected to find the help that they need. There can also be communication barriers such as lack of openness and emotional difficulty. As we all know that as Swazis, there are some things that are more of not proper for us to share, and you may have emotional difficulty, as you may be at a stage whereby you haven't even accepted what's happening to you. You may be in the denial stage and feel like this is not something you are up for. So it can be a barrier in trying to assess family needs. We also have emotional distress that may affect the ability to articulate their needs, which also goes on to the previous point that most people find that they have been accepted their illnesses or the illness of their loved one, and they're still on the denial stage, which can cause a lot of problems in the assessment. Also, time constraints can be a limit, as healthcare workers can have a challenge with time, and it can limit their depth and thoroughness of the assessments. There's also confidentiality and privacy, as families may be hesitant to share information, as they may believe that you're an outsider and you are not supposed to hear family news. Because most of the time, as Swazis, we believe that some sicknesses are as a result of witchcraft or family conflicts that may cause one to behave or be the way that they are. So confidentiality and privacy may be a challenge in family needs assessments. So once the needs of the family have been assessed, it is essential to provide them with the support they require. This may include access to counseling services for emotional support. This goes on to the clients as well as the family, as they all need counseling, as the changes that are there that can be stressful to them and can take an emotional toll on every member of the family. So access to counseling services is very much important as a way to support our family. Also, regular communication and updates from healthcare providers is crucial, so that they can know what's happening, what they should expect, what's going on, if there are any changes with the clients or whatnot. Also, referrals to community resources for practical assistance can be one way we can support the family. Maybe finding our community carers, but today who can come over to provide practical assistance to the family. Also, respect for cultural and spiritual beliefs is very important, as some people may prefer going or practicing cultural or traditional ways that can help them cure whatever that is the illness of the client. Some people may believe that if we take the clients to pastor so-and-so, that can be helpful. So it is very much important to respect their cultural as well as spiritual beliefs. Also, ongoing bereavement support for families following the death of a loved one is crucial, because even if the client that we were having is not there, but the family is also in need of a support, as they also have to adjust and accept the new norm that this family member is no longer there. So it is important to provide bereavement support for family members following the death of a loved one. In conclusion, family need assessment and support are essential components of palliative care, and by understanding the needs of the patient's family and providing them with the necessary support, healthcare providers can help to improve the quality of life for both the patient and their loved one. It is important to approach palliative care holistically, taking into account the needs of the entire family in order to provide comprehensive and compassionate care. Thank you so much.
Thank you, Mavuso, and wow, what a great presentation. I hope we have been reminded exactly what she has presented on family assessment and support. There are things maybe I will say I've taken from the presentation before maybe I give you the opportunity to also share. Maybe one of the things is to understand the different theories that are there that can support the evidence that indeed, wherever we are taking care of the patient, let's remember that they are not living alone, but whatever I'm doing with the patient affects the family. And taking care of the patient alone to me sounds as if I'm just taking a patient alone, ignoring the fact that the 90% of the patient is behind. So we need to involve the family as much as possible as we can, because some of the decisions and things that will gonna happen on the patient rely on their social system, especially the immediate system, which is the family. So that reason means that whenever I'm doing any plan of care, that plan of care must be comprehensive as much as possible as I can to include the family, not treat the patient in isolation. I'm just thinking of us giving a patient morphine. It's like we're giving the whole family that morphine. Taking the patient to ICU, I'm taking the whole family to ICU. Taking my patient to surgery or theater, the whole family is in theater. So even then, I will not include or understand the family the patient is coming from. I'm not doing anything other than causing more harm that may backfire tomorrow in another way. Another thing that I've taken here is that the family has the similar needs, like when you will be treating the individual client is. They have their psychological needs, they have their information needs, and they have their practical needs, financial, social, spiritual, and bereavement needs. And we need to take care of all this. Actually, these needs are covered in the 8 domains of palliative care. So when we talk of psychological needs, we need those interventions that we need to find out how are they coping with the situation. We need to look around the issues of how are they dealing with the stress, the emotional drain of seeing your loved one going through a cancer, going through dialysis now and then again, suffering from multiple sclerosis, suffering from whatever condition that is progressive and leading to death. And sometimes also the time when treatment are failing, so they undergo some trauma that we might ignore and focus on the patient. And they have information needs. And I think as a clinicians, especially in our context, we need to look closer, even in terms of information needs. From diagnosis going forward, whenever you are diagnosing this client of cancer, of any these serious illnesses, know exactly what the family is going through. And it's very important to know what type of a family, the cultural and the spiritual part of the family, because then when you are breaking the bad news, know exactly that the family must be incorporated. So when we are treating the patient, how can it be nice when we will be doing it together with the family? Even information needs, sharing the information with them, not assuming they know. You know, sometimes we will feel that this is a nurse or this is a doctor, then the assumption will be possibly this patient knows. Only to discover that, yes, he is or she is a clinician, but he knows nothing. And the practical needs, you know, part of palliative care is that we provide practical needs, food, clothing. You know, they need practical support with different needs that they are going through. And the financial needs in our context in the country, it's something that we are all aware that indeed, when it comes to financial needs, they determine how the patient we are taking care of will adhere. For example, if my patient is supposed to go for certain scans and chemo, will they afford? What are financial implications that are going to go to, and what can we agree on with the family? I like what Manzini Hospital said last time, that, you know what, now we are planning to incorporate the family even before we start chemo or whatever. That we may go together, but these are the things that we need to look around when we are with the family. The spiritual and cultural needs. This is so funny because we are in Eswatini, and the assumption that we are a Christian-based country, but on real ground, you discover that even if we may think we are a Christian faith country, but we are so much diverse in what we are believing in and what we need to take option on. And sometimes patients end up defaulting some treatment because of the cultural things. Who makes the decision? No? What is the taboo to us? What works well? So we need to get all those things. And one of the needs that I've picked from here is that even when the patient is going through some loss and grief, the family also is going through that too. So the bereavement support should be an ongoing thing. Even after the patient has died, the family has to be taken care of which we might find that in our context in the country we are still lacking. I hope today we will discuss how best can we do these things. When the patient has come for hospital visit, what can we do for the family? Because we end up having the client coming to hospital, but the family has nothing. What can we do? And then another thing I've understood that the social worker has mentioned that one of the things we need to do, we consider, is the counseling and the psychological support. It might be the CBTs, it might be the group psychosocial therapy, psychotherapies, you know, the group motivational counseling we have with families. It must be the communication with the patient. I like the communication because it's the backbone of palliative. The day in palliative care we will lose communication, we will have lost the journey. Whereby we communicate what is happening now, or what is going to happen, and what is it, when are we withdrawing, when are we withholding, what will be the change. And then we also look around the issues of the referral and linkages of these people. As healthcare workers, we need to know where to refer these families and these patients for support. We are grateful that in this point in time, we are able to use our team. We appreciate that from you clinicians who are from the hospital, as we are also referring them back to hospital. It helps the families. I've seen the impact that it has when the patient will be diagnosed early, and together with their families, they are linked with the home-based unit, they are linked with certain services that they can get help from. You know, the stress goes down. When there's nothing so to see families so happy. And also said that we need to also be respectful of the spirituality. We will treat spirituality and spiritual care in this module, whereby how can we provide spiritual care and be cautious of the spirituality of the family and the patient. How then do we balance maybe the issues when the patient has a different spirituality and the family has a different, but how then do we support both of them to work together in improving the quality of life of this patient? So, and then ongoing bereavement from diagnosis until post-death for the family. How do we go around that? That's what I've get from this presentation. Actually, recently in June 2023, there was an article from the definition of palliative care in palliative care. It includes adults and children. So, but today we're looking at the family as a whole, as a client, how best we can support them. May I open this opportunity to you colleagues that you may share what have you taken from this presentation? How does this in your context feels like? And I'm grateful we have hospital-based team and home-based care team. That makes it so nice because then we are sharing now. How does family assessment and family support works for us? We can share. The presentation will be there on our IECO platform if you will need to go back again and display. But now, Can I give the platform for us to share this assessment? Anything you want to add? What your experience? What can you share with the team as far as this contest? As I've mentioned, you are allowed to share with the client or ask anything concerning the client, but privacy in terms of the real location of the patient. You may say the region, but no name and surname, whatever concerning that patient. Yes, anyone who wants to share? In the room today, I'm with social workers here, so I'm blessed. Yeah, if we may want to share some insight, I don't know if Tandas has joined with his head team of social workers there. But what can we say about this, the strength of the family? You know, the definition says that to improve the quality of life of patients and families. Yes. Improve the quality of life of patients, that's adults and children and their families. So we're dealing with the family today. If I could read the definition for today's concept, I would say that it's an approach that improves the quality of life of patients, adults. I would read it like this: improve the quality of life of families faced with problems associated with life-threatening and limiting illnesses. Through prevention and relief of suffering, through the early identification and impeccable assessment and treatment of pain and other problems, whether physical, social, psychosocial, and spiritual. So that is how I will paraphrase it for today. So palliative care, an approach to improve the quality of life of families faced with this life-limiting condition by preventing and relieving suffering through the early identification of these families, impeccable assessment, treatment of pain and other problems, psychological, physical, and emotional. So, but I'm just paraphrasing. But for today, what is your experience? What can you share with us? What has it worked for you? What challenges have you faced? Yeah. Or you can add any comment on chat if you have a challenge with the network. Today does not seem good with the network. Yeah. I hope the silence means that we are all happy. We are all happy and content on what has been shared today. Yeah. I know that sometimes with the hospital-based team, providing practical support sometimes might not be feasible. But, you know, I don't know oncology team, but what I can share with you, team, is that one of the practical needs that we may do and provide, whether you're hospital-based or, for example, currently in the country, we are seeing adult diapers back, okay? So may I request that we order those things? So we have them in our facilities. They are back, and we remember they were there during the AIDS era, but then they faded out when we were moved into our 95. But with the insurgence of NCDs and stroke and other conditions that requires patients to be bedridden, they are back there. I was visiting other patients in the different communities, and one of the things I discovered was that when their patients are going down the disease trajectories, they lose a lot of functionality. So you find that now most of the patients are going to ECOG 3-4, and they last long there. So then financially, when the families go to the shops, I don't want to mention the shops, When they go to the shops, then they find that diapers cost almost 500 emalangeni, 400 and above. So they become more expensive. So I don't know, but I can say that's one of the practical needs, except that there's food that they may need. There are hygiene supplies. Those who have vaginal discharges and stuff, they may need sanitary pads more frequently. There's food. There are other needs we can calculate on. That we may work together to find. I'm still pushing that as palliative care team. I see that some of my colleagues are dropping off because of the Wi-Fi issue. Yeah, we have lost electricity, but we are hoping it will come back. So that's what we can share and say that I'm just sharing one of the things that are there. Sometimes having those moments to pray with the clients, when we have those good offices for palliative care, just go to the room and pray with the family. But yeah. But let me give to you, colleagues, if you have something to share.
Hi, Mr. Mahlangu and team.
Yeah.
Yes, it's Tandazile here. Your partners were really struggling with our connection here.
Okay.
I hope you will indicate whenever there is a problem.
Yeah.
Okay. Oh, okay. Thank you so much for the presentation, and I'm sorry for joining a bit late. It was a busy day this side today. Otherwise, thank you so much for the presentation. I don't know how best can we try to work around the issue of family involvement and in as far as palliative palliation and hospice is concerned, because really I think we really need them more than we ever thought. I'll just give you an instance whereby we had a client who was supposed to go for a colostomy. Client was reluctant to go for the colostomy. But then we had to come back, sit as a team, because, okay, we want to send this client for a colostomy. Then after doing the colostomy, how is he going to sustain that? Because we are already struggling with provision of colostomy bags.
Yeah.
So now, which brings in the issue of us involving the family to say, ordinarily, this is what we would have wanted to do, so that they can say, okay, if you guys are going to do this operation and it will require so much, rather let us not continue than us starting something that we are not going to be able to sustain.
Yeah.
So if we were disregarding this aspect of care, the involvement of the family, we would have probably gone on with continued doing the surgical intervention without actually considering if they will be able to sustain the life after that. Instead of trying to give comfort to the client, now we are causing them financial distress. We are exposing them to frustration that they wouldn't have, but rather they could have said, okay, instead of us going that route, let us just leave things as they are, because the other route might be even more expensive than what we are going through right now.
Yeah.
Then the other issue would be of, sometimes when you are with the client right before you do your own assessment, spiritual assessment, you check, okay, spiritual values, cultural values, you find that the client that presenting before you has got probably personal preferences in as far as spiritual and cultural values are concerned. But then he is going back to a family. Let me make an example. You have a kid, or you have a wife to someone. Maybe a wife to someone who is very traditional and doesn't really believe in your way of doing things or your Western way of doing things. And that person is supposed to go back home and he will be in that family, in that setup that doesn't believe in your way of doing things. So you find that you have already caused conflicts, and not because it is by choice, it's because they do not have the information that they are supposed to have in order for them to make those informed informed decisions. So I don't know really how best can we handle this one, because you find that it is very difficult having those significant others coming to the hospital. In our setting, I'll make an example, we do not have a community team. So it becomes a bit difficult having them to come over, yet you really need their support. Just yesterday, I was referring one client to EHAH. We are yet to finalize. This client is actually around town because she's basically from the deepest side of Shiseleng region. So she's like, if I go back home, I might not be able to attend my sessions and everything. There's a lot going on actually. But now the father back home is insisting, yeah, when you should come back home. And the client is saying, no, I cannot go back home because I won't have the money of coming back that side. So we were trying to engage Hospice to assist us do the family meetings back at home. But I don't know how best can we approach this one, because really at this point, we think we need the family involvement more than we think we need the curative or whatever interventions that we are using, be it your chemotherapy or whatever that we are actually dealing with the side.
Yeah.
I think that would be my contribution.
Yeah, thank you so much, Tandazil. Unfortunately, because of the EEC issues that we are going through here, we have lost the Shiselweni region. I hope he will personally respond to it. But I believe if the client can be linked with the hospice team, I hope our regional nurse can make means to meet the family and get to know their perception and understand the important proposal from the oncology team unit together with the patient, so then that can be discussed even with the patient and see if there can be a way forward, or at least that information be shared with them. I hope that can be done, or even the nurse can contact you and then you find out what exactly are you looking for, so he can then look means to meet them, but then go there with the understanding what your team actually wish to do together with the patient, so that then way forward could be negotiated in terms of cost. So I think that one can be done. I think what you're saying, the other thing is it's 100% sure. We need to include the families. Actually, if we could practice palliative care at its best, you can discover that I'm grateful that you have even made a good decision not to put a patient into certain suffering just to achieve the medical goals that you have, but incorporate the clients in the goals of care. Because if we could go now, I think that's a powerful decision we've ever made. If I could have a trumpet to shout at the highest mountain in the country and say, do you see how important it is to practice palliative care when you're taking care of the patients? I don't know. Look at how Manzini has achieved greatest things with the patient. So yeah, it's very important to include them and give them the information, all of the information, so that whenever they decide to go, they understand why. Whenever they decide to stop, they understand. You are just an advocate. How much I wish we could all be doing that. And let's all try, but also to incorporate, go use this approach of palliative care, include the families. They can help us a lot. Sometimes where we cannot have the strength, they will help us because we have never hidden anything. But all in all, it's based on how open the client was to us and whom is the family, and then we keep on assessing and assessing, continuous assessing, so we can meet all the needs. And whenever there are different ideas from the patients and the families, we then go in and say, this is the middle ground, how best we can move together. Yeah, I can see that everyone is dropping. Maybe due to the network, and everyone is not here. Maybe we might need to end our session because most of our team members have dropped off, and I don't know if they will be back very soon. So yeah, so everyone is dropping. But I was just saying that thank you so much for sharing this experience. It will help me and my team a long way. How much I wish these achievements could be written down somewhere. So whenever we meet other people, to encourage them to use palliative care approach in taking care of the people, they could understand the significance. I'm now beginning to be economist, from your presentation, to say, you know what, if you did put this patient to this operation, you will be spending doctor's time, that's money. You will be spending equipment, that's money. You will be only to find that all what you were creating was to cause harm to the patient. But now you can sit down and reflect and say, it may seem like we were refusing to do the operation on our own, but sitting down and thinking of, we did the best for this patient. Look at how this has impacted the patient and the family. So thank you so much for making such an improvement. Actually, I think even for us and those who will watch this video, it will make sense. You know what? Let's come with the palliative care approaches. There are many medical interventions we have subjected our patients into, and we have found that, it has become worse than we were saying we were helping. And unfortunately, they were not given the opportunity to make an informed decision. So thank you so much to share that with us. I don't know if my team will ever be back again, because I see all of them collapsed. So I don't know whether they will come back or they will not, but I will pass the message to them. But I can say, do call the reception when we have made the decision to say let's link them to hospice. I can see someone here. Oh, this is praise. Why are you posting it? Say it. May I give this opportunity to praise to say something? You can say it.
Okay, thank you, Devanta, for the well-articulated presentation. I just want to highlight that one of the transboundary challenges that we face is that oftentimes after assessing a family's needs, we find out that we lack sufficient resources to assist the family.
Yeah. Many constraints.